How often are you supposed to use an inhaler for asthma? This is a really good question. So there are three different types of inhalers that we use for asthma. The first is a reliever, the second is a preventer, and then a third is a combined one with both of the previous things in it. So a reliever inhaler is usually a blue inhaler, and you're only really meant to use that during an asthma attack. You then have preventer inhalers, which can usually be brown inhalers like this. They contain a steroid in them, and the whole point of these is that they're meant to reduce inflammation in the airways over a longer period of time, so that you should hopefully not really need to use your blue inhaler at all. If you are using your blue inhaler, so your reliever inhaler, more than twice a week on a regular basis, then please book an appointment with your doctor or asthma nurse, because your asthma needs to be better controlled. In an ideal world, with appropriate prevention, you shouldn't really need to use a blue inhaler at all. Now, brown inhalers are usually used twice a day, long term, but the dose, the number of puffs, the amount of medication that's in each dose is entirely dependent on your individual case, so I can't comment on that. The combined inhalers, so these usually have a steroid in them and then a long-acting version of the blue inhaler. These can be used once a day, twice a day. They can be used when you're having asthma exacerbations. But again, the frequency and the dose is all dependent upon your specific case. So again, if you're not sure what you should be doing, please have a chat with your doctor. Generally speaking, with good prevention, you shouldn't really need to be using your reliever inhalers or even your combined inhaler as a reliever that often.